Now we will be seeing some videos about the sleep. In this video is just kind of the big picture of sleep and the waves. In other videos, in future videos, we will talk about the sleep sleep disorders like sleepwalking, sleep talking, and nightmares, and then about narcolepsy, etc. So the latency of sleep is the time we take we are on the bed, then to get sleep is called the sleep latency, and is 5 to 15 minutes. In the sleep we have the REM and non-REM. REM is rapid eye movement. We begin in the non-REM. The non-REM is divided in stage 1, 2, 3, and 4. We spend most of the time in stage 2, like 45% of the time is in stage 2. 3 and 4 is each one like 12, 13%. This is like 5%. So we begin in the non-REM. In the non-REM, the brain is inactive. There could be some thought likes, but the brain is completely inactive here, and so the eyes are not moving. In the stage 1, the wave that we will see on EEG would be the disappearance of alpha. I forgot. When we are awake and we are paying a lot of attention to something, we are in beta waves. And if we are just listening, kind of not paying much attention, or like just in the bed closing the eyes, we are in alpha. So beta and alpha waves would be what we see on the EEG. In the first stage of REM, then the alpha waves begin to disappear, and is the appearance of theta waves. Theta waves are like this: low amplitude and high frequency. As we go on, the stage 2, there is a little more increase in theta waves that we see. The amplitude increases a little bit, and we have two characteristics patterns. One is we will see K spindles. K spindles is that in the EEG in a part we will see something like this. This is a K spindle, and the other is we are having just things like this, and a K complex is something like this. Kind of an extrasystole in the EKG. Anyway, this is the K complex. In stage 2 is where bruxism takes place. In stage 3 and stage 4, the waves are delta waves. Delta waves that have the lowest frequency and highest amplitude. So these are the delta waves. In stage 3 and stage 4 is where the nightmares occur, and in nightmares the child is able to be calm, so can go with the parents, and the parents calm the child, and then the child go back to sleep, something like that. In the next video we will do some differences between nightmares and sleep talking, sleepwalking, etc. Now now we have the REM stage. REM stage occurs every 90 minutes, so the REM latency is 90 minutes, and the duration of REM increases as the time goes by, as the night goes by. So in the second half of the night we spend more time in the REM than in the non-REM, and we spend more time in non-REM in the first sleep than in the REM. So we are alternating like stage 1, 2, 1, 2, 3, 2, 1, something like this, and at the second half of the night we have more REM than non-REM. REM is rapid eye movement, and this is because now here in the REM stage, the brain is active, in a paralyzed body. The muscles are paralyzed, so here is where dreaming occurs. And also there would be increase in acetylcholine, sexual arousal. And here, as compared to the nightmares, here occurs the sleep walking and sleep terrors. Sleep terrors occur here, and the child is not calm in a sleep terror. We will talk about the difference in the next video. And the other thing is that in the REM sleep, all the muscles are paralyzed except those of the inner ear and of the eyes. So because there is activation of the paramedian pontine reticular formation, we have the REM, rapid eye movements. Now in the next video we are going to talk about the disorders of sleep and how some neurotransmitters affect these pathways and what diseases affected this, like in depression or in aging or something like that. For now, just to note that serotonin induces the sleep, the REM, and the acetylcholine is increased during sleeping, and norepinephrine is increased in non-sleeping.